Leonid Rogozov. In April 1961, Leonid Rogozov cut open his own abdomen with a scalpel to remove his own appendix. Alone, in Antarctica, with no one able to help him. He was 27, the only physician on the Soviet Union's 6th Antarctic expedition, stationed at the new Novolazarevskaya base, surrounded by glacier in every direction. On April 29th, he developed a fever, started vomiting, and felt sharp pain in his lower abdomen. He diagnosed himself immediately, acute appendicitis, hours from rupture. The nearest base sat 1,000 kilometers across the ice. A polar storm had grounded every aircraft. The supply ship would not return until the following year. He had no choice. He trained a meteorologist and a driver to pass instruments and inject adrenaline if he lost consciousness. He lay on his side, injected local anesthetic into the skin of his abdomen, and made the incision. He tried a mirror, but the reversed image threw off his accuracy, so he abandoned it and went by touch, feeling the organs with his fingers. For 1 hour and 45 minutes, his heart slowed in waves and his hands went numb. Exactly as he later wrote in his diary, he found a 2-centimeter perforation at the base of the appendix, on the verge of bursting. He poured antibiotic directly into the open cavity and sutured shut. 18 days later, Yuri Gagarin flew to space, and the Soviet propaganda machine made Rogozov a national hero. Both Australia and the Soviet Union began requiring every polar physician to have his appendix removed before deployment. Robert Kerr, Jock McLaren. In August 1944, deep in the jungles of the Philippines, Jock McLaren sliced open his own side with a pocket knife to take out his appendix. No anesthetic of any kind. 4.5 hours of work. He was a Scottish-Australian veterinary surgeon who had already escaped Japanese captivity twice, first from Changi Prison in Singapore, then from the high-security camp at Sandakan in Borneo. By 1944, he had joined the American guerrilla force led by Colonel Wendell Fertig, harassing Imperial Japanese units scattered across Mindanao. On patrol, he felt the unmistakable pain of acute appendicitis. He knew exactly what it meant. The organ would rupture within hours, and there was no hospital, no airlift, no truce. Japanese troops were a few kilometers from camp. He worked with what he had. He strapped a small mirror to his knee, boiled coconut husk fibers to use as suture thread, and picked up a pocket knife. He cut his side open, found the appendix by feel using the anatomy he had learned operating on animals, and removed the inflamed organ. He stitched himself closed with the plant fiber and rested 2 days before returning to combat. In the weeks that followed, he led machine gun raids in an 8-meter motorboat christened the Bastard against Japanese-held harbors, earning a bounty on his head from the Imperial Army. He survived the war, returned to Australia in 1945, and died in a truck accident in 1956. The scalpel had been kinder to him than the road. Jerry Lynn Nielsen. In June 1999, Jerry Lynn Nielsen felt a lump in her own breast, 5.5 centimeters across, and realized she had cancer in the most isolated place on the planet. She was the only physician among 41 people wintering at Amundsen Scott's South Pole Station, with the outside temperature at -73 degrees Celsius. For 8 months, no aircraft could take off or land. At that temperature, jet fuel turns to gel and hydraulic systems freeze solid. With no pathologist on the continent, she had to build an entire medical team out of the people around her. She trained a welder to insert IV catheters and taught a heavy equipment mechanic and a machinist to administer chemotherapy. A colleague rigged a digital microscope out of a webcam and a borrowed lens, beaming slide images by satellite to oncologist Kathy Miller at Indiana University, who confirmed aggressive invasive ductal carcinoma. The U.S. Air Force airdropped chemotherapy drugs onto the ice, and Nielsen began administering Taxol, and later an oral cocktail of methotrexate, fluorouracil, and cyclophosphamide, to herself. On October 16th, she was evacuated by LC-130 Hercules at -58 degrees Celsius, weeks earlier than any aircraft normally lands at the pole. The cancer returned in 2005 and spread to her brain, liver, and bones. She kept lecturing until 3 months before she died in June 2009. Her autobiography, Icebound, was adapted for television and became the standard reference for medical practice in extreme isolation. Evan O'Neill Kane. Evan O'Neill Kane operated on himself 3 times in 13 years, and during one of them, his own intestines slipped out through the incision, and he tucked them back in like a man straightening his necktie. He was chief of surgery at Kane Summit Hospital in Pennsylvania, and he wanted to prove you could operate on a patient who was awake, with anesthetic in the skin only, instead of putting them under with gas, which in his era killed more than 10 out of every 100 people sent to the operating table. In 1919, before antibiotics existed, he amputated one of his own fingers because the infection was climbing up his arm towards sepsis. On February 15, 1921, at age 60, He infiltrated cocaine and adrenaline into the skin of his abdomen and removed his own chronically inflamed appendix in 30 minutes, with 3 colleagues on standby in case anything went wrong. The intestinal loops escaped during that procedure, and Kane folded them back into the cavity without changing his expression. He told the New York Times the next day that he wanted to know exactly what the patient feels under local anesthesia, and he insisted that any surgeon, provided he is not too obese, may operate upon himself with perfect ease and even comfort. In 1932, at age 70 and 2 months before he died of pneumonia, he repaired an inguinal hernia from a horsefall, the incision passing millimeters from the femoral artery. Charles Auguste Claver de Maldigny. In 1824, Charles Auguste picked up a mirror, cut himself open between his own legs, and removed the 6th bladder stone of his life, after 5 earlier operations performed by colleagues had left him with chronic urinary complications. He was a junior surgeon attached to the French Royal Guard, and he had spent years living with constant pain and recurring infections from those failed attempts. In his era, perineal lithotomy, cutting between the genitals and the anus to reach the bladder, killed roughly half of all patients, and anesthesia did not yet exist. You stayed awake and felt everything. Maldigny stationed himself in front of a large mirror, lifted his scrotum with his left hand, and made the classic incision between the genitalia and the anus. He cut through the external anal sphincter, through the wall of the rectum, traced a path to the bladder through the scar tissue of his earlier operations, and pulled the stone out. When the stone was examined, they discovered something absurd inside it, a surgical sponge left behind by a colleague during a previous procedure. The stone had crystallized slowly around the foreign body. 3 weeks later, according to the 1824 journal Médico-Chirurgical du Var, Maldigny was tranquil and cheerful, as if he had never suffered. When a 7th stone appeared years later, he let another surgeon use the new, less invasive lithotripsy technique developed by Civial in Paris. He had had enough of himself. Werner Forssmann. In 1929, a 25-year-old German surgeon named Werner Forssmann threaded a 65-centimeter tube through his own arm vein into his own heart, with no prior evidence that the passage would not kill him on the spot. He was working at the August Victoria Hospital in Eberswalde, and he wanted to prove that the heart could be reached from inside, through the veins. His boss, Richard Schneider, refused. He called the experiment suicide. So Forssmann staged a deception. He convinced his nurse, Gerda Dietzen, that he would run the procedure on her, strapped her to the gurney, anesthetized her arm with a local, and underneath the surgical drape, threaded the catheter into his own left arm. A colleague named Peter Romeis caught what was happening and tried to physically pull the tube out of him. Forssmann fought him off, kept the catheter in place, and walked through the hospital corridors to the X-ray room to record the image of the tube parked inside his own heart. The radiograph still exists. He was fired from the prestigious Charité Hospital by the legendary Ferdinand Sauerbruch, abandoned cardiology, and went on to practice urology in a small town. 27 years later, in 1956, he received the Nobel Prize in Medicine, shared with André Cournot and Dickinson Richards, who had refined the technique. Today, cardiac catheterization saves millions of lives every year in patients who never knew the name of the German who once locked himself in a hospital room with his own vein. Bertram Alden. In 1912, American surgeon Bertram Alden tried to become the first man in history to remove his own appendix, and had to stop midway when his only assistant threatened to walk out of the room. Alden suffered from chronic recurring appendicitis at a time when general anesthesia by ether and chloroform killed more than 10% of patients on the operating table. Operating on yourself while awake, with cocaine infiltrated into the skin, was emerging as the safer option for surgeons who understood the risks of the gas, but it required someone else willing to watch. Alden began the resection lying on his back, with a single colleague helping, advancing through the abdominal layers with clear technical command. The assistant, watching at close range, a man cut open, conscious, slicing into his own abdomen and handling his own organs, could not take it. He threatened to abandon the room mid-operation and forced Alden to stop before the appendix could be removed. The procedure was aborted, half-sutured, and Alden survived. The case lived on as a technical note in a 1936 issue of JAMA and was cited again in a 2018 study as the aborted prototype of modern abdominal self-surgery. It became the failure that paved the way for Kane in 1921, McLaren in 1944, and Rogozov in 1961, proving that the bottleneck of self-surgery was never anesthesia or anatomical knowledge. It was the stomach of the assistant. Alexandru Țaicu. On September 23, 1909, in the Romanian city of Iași, Alexandru Țaicu sat down in a room full of doctors, with a photographer in the corner, and opened his own left groin to repair a hernia the size of a chicken egg. He was 26, and he wanted to prove two things at once. that major surgery could be performed using a new anesthesia injected directly into the spine, rather than ether or chloroform applied to the face, and that this anesthesia, developed by Romanian surgeons Toma Ionescu and Amza Gianu, was reliable. The hernia, if left untreated, could trap a loop of intestine outside the abdominal wall, cut off its blood supply, and kill him within hours, which meant the operation was also a genuine medical necessity. He was assisted by Ernest Juvara, professor of surgical anatomy at IASI, but he operated on himself from start to finish. He reduced the hernia sac, closed the muscles of the groin, and sutured the incision unaided. 12 days later, he was back operating on other patients at the sanatorium. The procedure earned him his doctorate in surgery and was documented in 2 European treatises, Toma Ionescu's General Spinal Anesthesia and Raymond Nogue's Treatise on Stomatology. It was the first documented self-performed hernia operation in the world, 12 years before Kane's appendectomy and 2 decades before Forssmann's catheterization, and it remains the earliest formal case of surgical self-experimentation on record in modern European medicine. Every blade on this list cut its owner because the alternative was death. If this catalog hooked you, subscribe for more, and tell me in the comments which case landed hardest.